So it's May. Did anyone know how many awareness months impact me right now? It's 2. So I want to talk about those for a minute. But first, I'm Rob, also known as Dead Nut. May is Motorcycle Awareness Month, and as you can see, I ride a motorcycle. In Canada, that's when bikes start coming out of hibernation a lot more, and you're going to see them out and about everywhere. And a lot of people aren't expecting to see them, so they get cut off a lot. It's just not in a person's mind space to watch for motorcycles in Canada. So that's why a lot of the provinces have their Motorcycle Awareness Month in May. Just remind people that, you know, motorcycles are back on the road, and they're smaller than cars, so they're not as easily seen. Now, I do tend to stick out in a crowd because I'm on a large bike and I'm a large guy. So I probably have the same mass as a smart car. So anyway, that's one of the awareness months, motorcycles. So watch for motorcycles. My family appreciates it. The second one is bladder cancer. Because, you know, if you follow my channel, and if you're new here, there's some content on here about bladder cancer, because I was diagnosed with it in 2014. If you want to learn more, check out the various playlists on this and my other channel about bladder cancer. Because this is my public service announcement for the May Awareness Month of bladder cancer. So, I have lots of interesting comment. If you're new here, please subscribe. Thanks for coming. And so bladder cancer is the 5th most common cancer. A lot of people didn't know that. And in Canada, 12,500 men, or correction, people, because it's 75% men, 12,500 people will hear the words, "you have bladder cancer," in Canada. So that has gone up. I was diagnosed in 2014. Back then it was around 83 to 8,500 people a year. So that is a 50% increase in 8 years. Now, that shouldn't be something to scare you. What it is, I think, is awareness helps. Awareness works. People who get diagnosed with bladder cancer early have great odds of survival. The mortality is nice and low. And we're finding that the mathematics, because when I was diagnosed, median age was 73. So a lifetime smoker in his 70s was most likely to get bladder cancer, yet I was a non-smoker in my 40s. So that demographic is shifting, and I think awareness plays a huge part of it. People are more focused on hearing about bladder cancer, because when you actually start talking about bladder cancer, there's actually a large number of people who you probably know who have been impacted by it. They just don't talk about it. So awareness is talking about it. And we really need people to talk about it, because that only helps. So bladdercancercanada.org is the website. Is a Canadian resource that's actually recognized internationally as a great resource and a great community for bladder cancer patients. So if you have concerns or questions about bladder cancer, go there. And most of all, the number one symptom for bladder cancer is blood in your urine. Now, that can also be a whole bunch of other things, but what's happening now due to awareness of bladder cancer is people are not accepting it. You know, the doctors just sort of saying, oh, it's not bladder cancer, even though they haven't ruled it out. They're just saying you don't fit the profile because you're not a 73-year-old man. So that speaks to some of the things we start to hear is, you know, don't accept the first response if you're unhappy with the doctor and he's saying it's not bladder cancer, but can't give you just a reason why, or haven't ruled it out through a cystoscopy. Cystoscopy is the way to rule it out. That's the only way you can truly confirm or deny. And that's a camera look inside your bladder. Yes, it is not as comfortable as it sounds, but it only lasts for a moment. And, you know, I'm sure if you ask the oncologist nicely, they give you a videotape of it. I haven't asked for one yet. But all those things being said, if you have persistent blood in your urine and it's not being followed up on, you know, a cystoscopy can rule out bladder cancer. And it's a short procedure. It doesn't take long. So, see red, see your doctor. But, you know, bladder cancer, if found early, can be treated effectively. Now, there's going to be some podcasts coming out on Bladder Cancer Canada that talk about the different things like BCG. I've got some stuff on my various YouTube channels talking about BCG and the treatment that you go through. And it's surprising how many people just don't know about it because, well, they just don't know because it's not talked about. And that's how awareness helps. So I'm really, you know, really want to push that whole awareness concept. That you have to talk about it for more people to be aware of it so that when something comes up, they're like, oh, I heard that guy talk about bladder cancer. It's not uncommon. And because people don't want to talk about it because of access points, it makes men uncomfortable. Which I've turned into a bit of a bar trick of making men wince in pain, but that's just me being a bit of it. Yeah, we won't use that word. Anyway, spread the word. Talk about bladder cancer. Have yourselves a great day.